Good afternoon. We're joined by Dr. Jennifer Linehan. She's an associate professor of urology and urologic oncology at St. John's Cancer Institute in Santa Monica, California. We're happy to have you with us today. Thank you for spending your time. What was your favorite thing about attending IFRUE, and what was your greatest takeaway?
My greatest takeaway was getting to be introduced to some of the other specialists, like world-renowned specialists in these areas of functional urology, of reconstructive urology. And while some of the topics to some might seem like they're very niche, they're very important things that we need to understand. Like even just treating stress incontinence or urge incontinence, or just being able to understand, again, like testosterone replacement, as far as how that plays into patients with prostate cancer. These are very important issues. And I think that's one thing as a robotic oncologist, I just don't get that kind of exposure to. And it was like a one-stop shop of this robotics, functional medicine, and all of the other important things that I need to pay attention to. And I think that's what was so exciting, because it was a different focus of robotic urology.
What advice would you give trainees who want to develop robotic expertise without allowing the technology itself to drive their surgical decision-making?
So I think the biggest, when I have a fellow, so I have a new fellow that's come on right now, and as he's gaining his robotic training, I told him that this is the year that he should go out and, number one, go to meetings, see how different people approach complex problems. Number two, try to get proctoring events. Go to different institutions, see how they run their OR, see how they place their ports. Think about all the little things that make a big difference when you're going out to practice, because I'll tell you, there are some things, you go see someone do a surgery or you watch someone do a live surgery, but you don't see how they put in the ports. And those are the things that you're going to be thinking about when you're out there and practice on your own. So it's their time to go to meetings, go get proctored events, watch videos, ask questions. I think that is the biggest advice, is that take that time, especially during your fellowship, or even when you go out into your first year in practice. If you're out of your fellowship or you just come out of residency, take some time in your first year of practice. I know you want to build up your practice, but it will actually benefit you to put some time into learning and how you want to do things, and having a backup plan when you get yourself into trouble.
What makes IFRUE an important space for bringing both robotic innovation, the broader functional reconstructive conversation?
So NARS is the North American Robotic Society, and we have all types of specialties within that meeting. I've been part of the planning committee for that meeting for the past several years. There's a young NARS component, as well as there's a prostate session, a kidney session, a bladder session, and a recon session. And I think the reconstructive portion of that meeting is one of the most important parts, and tends to be one of the most impressive live surgery portions of the meeting. And so we usually do at least 1 or 2 live surgery reconstructive cases. And where functional urology fits into that is that we spend a lot of time focusing on taking out the cancers and not understanding how to fix the problems that sometimes we create when we do that. And I think having a unique setting, a robotic focused setting for reconstruction at NARS is incredibly important. And there's a lot of general urologists, and there's a lot of even robotic urologists that do some reconstruction, but reconstruction, because of its nature, is so broad-based. You have to have a lot of tricks in your bag when you're doing reconstructive cases. And it's meetings like NARS and IFRUE that give you that structure to understand, what are the things you can do, what are the things you can't do, and when you get in some tricky situations, what are your options?